Welcome to our deep dive into why a growing number of insured Americans are looking beyond U.S. borders for medical care. In this video, we will explore cost transparency, diagnostic quality, speed of access, and practical steps to safely evaluate international options. We will also provide a balanced perspective, including risks and a clear disclaimer. Here is our roadmap. First, we will set the context. Next, we will analyze the problem with domestic insurance. Then, we will contrast it with the international experience. After that, we will compare costs, walk through a step-by-step planning guide, discuss risks and mitigations, and finish with actionable next steps, a short quiz, and a closing call to action. There is a growing trend of insured Americans traveling abroad for medical care. Despite having coverage, many are finding better clarity on price, faster access to specialists and procedures, and strong diagnostic capabilities in international facilities. Before we proceed, a reminder. This video is educational and not medical, legal, or financial advice. For emergencies, call local emergency services such as 911 in the United States. Standards, regulations, and outcomes vary widely across countries and facilities, so thorough due diligence is essential. Finally, any costs or examples shown are illustrative and may change over time or by location. The U.S. insurance experience is often characterized by high deductibles, sometimes $2,500 or more, and high out-of-pocket maximums ranging from around $6,000 to over $12,000. Patients can encounter surprise billing, where they choose an in-network facility but unknowingly receive services from out-of-network providers, leading to unexpected charges and collections even after meeting the out-of-pocket maximum. Billing transparency can be limited. Obtaining a fully itemized receipt may be difficult, obscuring the true cost. Meanwhile, bureaucratic processes such as referrals, prior authorizations, and denials can delay access to diagnostics and treatment. Let's compare. In the domestic model, benefits can be complex, prior authorizations are common, billing is fragmented and unclear, specialist access may be delayed, surprise out-of-network charges can occur, and preventative or genetic services may require approvals. Abroad, care is often offered as a cash package, with a single upfront price that includes surgery, consultations, diagnostics, and accommodations. Billing is typically hyper-detailed and itemized. Scheduling is faster, care is coordinated, and patients can access preventive and genetic testing directly. Here is an illustrative snapshot of costs based on the context. For urgent complex surgery that includes specialists, imaging, a private room, and follow-ups, domestic insured patients may face deductibles, coinsurance, and potential surprise billing, with out-of-pocket maximums often between $6,000 and over $12,000. Internationally, the same scope of services may be presented as a single transparent package, around $3,650. Two comprehensive full-body checkups domestically may be subject to coverage rules and prior authorization. Abroad, similar packages may total around $1,150. Specific genetic testing domestically may require counseling or permissions and face delays. Abroad, direct access may cost around $130. This flowchart visualizes a structured decision process. It begins by asking whether the patient faces high costs, long waits, or a denial domestically. If yes, the next steps are to request an itemized quote abroad, verify accreditation and clinician credentials, and compare total costs including travel and recovery. A decision node evaluates whether savings meet a significant threshold and whether quality is verified. If both are true and continuity of care plans are in place, the pathway leads to proceeding abroad. Otherwise, the alternate path suggests negotiating domestically or seeking a second opinion. The flow also emphasizes arranging postoperative follow-up regardless of location. In many reported experiences, persistent medical issues that were previously dismissed or missed in domestic settings are identified more quickly by international specialists. The reason often includes coordinated multi-specialist evaluations that occur in a single pathway, along with advanced imaging and laboratory tests bundled within the same package without the need for multiple approvals. Access is often faster abroad. Patients can secure specialist consultations and procedures with shorter wait times. Direct booking can bypass domestic prior authorization bottlenecks, and many facilities offer single-day comprehensive testing menus that consolidate multiple diagnostic steps. This pie chart provides a conceptual comparison of where patient spending may go. A large portion can be consumed by domestic deductibles and coinsurance or copays, while an additional segment represents the risk of surprise or out-of-network charges. By contrast, the international option includes a defined package fee and typically smaller travel and logistics costs. The exact percentages are illustrative and will vary by case. Use this checklist when evaluating international options. Confirm recognized accreditation such as JCI or ISQA affiliated bodies. Verify clinician credentials, including training history, case volumes, complication rates, and peer reputation. Require a fully itemized quote covering supplies, labs, medications, imaging, and room fees. Establish a continuity plan for postoperative follow-up, including telehealth and local provider coordination. Ensure you receive all records digitally. Confirm language support. Verify travel, medical, or complication coverage where available, and review safety metrics including infection control and emergency escalation procedures. Here is a step-by-step approach. First, define your clinical need and gather complete records. Next, shortlist 2 to 3 accredited facilities and request itemized quotes and scheduling information. Then, verify the specialists' credentials, including training, volumes, and outcomes. Calculate the true total cost, including medical care, travel, lodging, time off work, and contingencies. Confirm that the hospital has intensive care capacity, a blood bank, and emergency backup on site. Arrange telehealth sessions before and after the procedure. Secure travel, medical, or complication insurance, and read all exclusions. Prepare medications, mobility aids, and caregiver support for recovery. Coordinate with a local physician for follow-up after you return. Finally, document everything and keep contracts, quotes, and receipts. This timeline maps a typical patient journey. 4 weeks prior, the patient gathers records and schedules virtual consultations. 3 weeks prior, the patient secures quotes and verifies credentials. 2 weeks prior, they book travel and complete preoperative tests. 1 week prior, they obtain final telehealth clearance. On the travel day, they arrive for pre-admission. Over the next 1 to 3 days, the procedure and inpatient stay occur. 1 week later, discharge and nearby follow-up take place. 2 to 4 weeks later, the patient returns home and completes telehealth check-ins. Around 3 months later, a final outcome review is conducted. There are real risks. Standards and infection control vary, so choose accredited facilities and verify safety metrics. Continuity of care can be challenging, so arrange local follow-up and telehealth in advance. Language barriers can be addressed by interpreters or bilingual staff. Complications may be harder to manage when you are far from home. Plan for escalation capacity and verify insurance coverage. Protect yourself from fraud by requiring written, itemized quotes and checking references. For medications, use hospital pharmacies and avoid purchasing from unverified sources. Quiz time. The question is, which combination best indicates you should at least explore international options? Option A, low deductible, rapid domestic access, full transparency. Option B, high costs or delays domestically, plus availability of itemized international quotes and verified credentials. Option C, unclear international pricing and no follow-up plan. Option D, minimal potential savings and no language support. You may pause the video now to think about the answer. We will discuss the answer in the next section of the video. The correct answer is high costs or delays domestically, plus availability of itemized international quotes and verified credentials. When domestic care is expensive or delayed, and transparent, itemized international quotes from accredited providers are available, it is reasonable to compare total value. This flowchart emphasizes continuity. It starts with preoperative telehealth and secure record sharing. After the procedure abroad, the patient receives a discharge package that includes records, medications, and instructions. There is a formal handoff to a local physician, followed by scheduled telehealth follow-ups and outcome monitoring. If issues arise, the plan includes escalation to a local emergency department or a structured return to the treating facility. Here are the key takeaways. Transparency is essential. Always demand itemized quotes. Speed improves outcomes when delays are reduced by coordinated pathways. Quality depends on verified credentials, case volumes, and outcomes. Continuity must be arranged before traveling. Finally, compute the total cost by including travel, time off, and contingencies. To move forward, Identify whether your main bottleneck is cost, access, or quality. Request itemized quotes from 2 to 3 accredited international centers. Verify credentials. And, when possible, speak with prior patients. Compare the total modeled cost against your domestic out-of-pocket exposures. Finally, secure continuity by scheduling local follow-up and telehealth sessions in advance. Thanks for watching. If this video helped you think differently about navigating healthcare, please like, share, and subscribe. Tell us in the comments what surprised you most, or what you want us to compare next.